I prefer seeing the blood coming out from my body than I don't see it at all. Internal bleeding kills, and a very bad type of internal bleed to have is internal brain bleed. Hi, I'm Dr. Dezwa, a neurology intern, and today we're going to talk about hemorrhagic stroke. Brain bleeds can occur from trauma, but this one I'm talking about is the brain bleed that doesn't occur from trauma. Intracerebral hemorrhage. Intra meaning inside, cerebral meaning cerebrum. Hemorrhage is bleeding. So intracerebral hemorrhage is bleeding into the cerebrum. I mentioned earlier that there are two types of stroke: ischemic stroke and hemorrhagic stroke. Ischemic stroke is the most common type, but guess what? Hemorrhagic stroke is the most deadly. A brain bleed can occur from blood vessels literally getting damaged, especially from hypertension, cause the blood vessel to leak blood onto the brain parenchyma. Apart from small vessel damage, an ischemic stroke can also convert to an hemorrhagic stroke. Brain tumors can also cause a hemorrhagic stroke. A hemorrhagic stroke can also occur due to bleeding relating to drug use. Okay, what happens when there is a bleed in the brain? Imagine having a bleed under your skin. You obviously see that it tends to swell up, become red, and be more painful. The same thing happens in the brain, only that the brain doesn't feel pain. When the brain bleeds, it increases the size of the brain. It's called cerebral edema or brain swelling. The skull is a very tight box. There is only one opening called the foramen magnum. It's like a little hole that leads into the neck, from the brain to the neck. The part of the brain that is close to the foramen magnum is where the respiratory center is. Anything that makes the brain shift down and enter that hole, the person dies instantly. That is what we call coning. The scary thing is that all these things happen within a matter of minutes to hours. If you've made it to this part of the video, I appreciate you, and I will see you in my next video where I will talk about the things that can actually cause us to have stroke, the risk factors of stroke. Till then, stay safe. Bye.